Hey everyone, this is Xactinsure, and for the past 3 years, we've been helping families navigate the complex world of health insurance. We've seen every trick, every loophole, and every way the system tries to work against you. But what happened on July 1st when the Senate passed the One Big Beautiful Bill is unlike anything we've ever seen. We're talking about the largest cuts to healthcare in American history. Nearly $1 trillion in cuts to programs that millions of Americans depend on. And here's the thing. Most people have no idea this is coming. The mainstream media is barely covering it. Insurance companies aren't sending out warnings. And Congress buried these changes in a 940-page bill that nobody reads. But we read every single page. And what we found will shock you. Let me put this in perspective for you. Remember when everyone was freaking out about whether the Affordable Care Act would be repealed? Well, this bill doesn't repeal it. It does something much worse. It takes a scalpel to every single part of the healthcare system and makes strategic cuts designed to make coverage more expensive, harder to get, and easier to lose. We're talking about the biggest Medicaid cuts in history, $930 billion over 10 years. Premium tax credits that helped 21 million people afford insurance? Gone. Special enrollment periods that let you get coverage during emergencies? Mostly eliminated. Automatic renewal of your health plan? Banned. Protection from owing thousands in surprise tax bills? Deleted. And here's the kicker. Most of these changes kick in January 1st, 2026. That's less than 6 months away. But here's what really gets me fired up. They did this in the middle of summer, right before July 4th weekend, when nobody was paying attention. They literally called it a big, beautiful bill, while cutting healthcare for millions of Americans. Let's start with the biggest gut punch, premium tax credits. If you're getting help paying for your health insurance through healthcare.gov or your state marketplace, listen up. Those enhanced premium tax credits that have been making your insurance affordable, they expire December 31st, 2025. Gone. Poof! Let me give you some real numbers here. If you're a family of 4 making $60,000 a year in Georgia, your monthly premium is going to jump from about $200 a month to over $800 a month. That's an extra $7,200 a year. If you're 60 years old and making $50,000 in Florida, your premium could go from $300 a month to $1,100 a month. That's nearly $11,000 more per year. And Congress knows this. The Congressional Budget Office told them that 4.2 million people will lose their health insurance just from this change alone. They know it, and they did it anyway. But it gets worse. Way worse. They didn't just make insurance more expensive, they made it exponentially harder to get. You know how your health plan automatically renews every year? Not anymore. Starting in 2026, you have to manually re-enroll every single year. And here's the catch. You have to verify your income, your address, your citizenship status, and a bunch of other stuff before you can get coverage. This isn't like renewing your Netflix subscription. This is like having to reapply to college every single year with financial aid paperwork, transcripts, and interviews. And if you make one mistake, if you're a day late, if your paperwork gets lost, no coverage. You're uninsured. Think about this. How many people forget to renew their car registration? Now imagine if forgetting meant you couldn't get health care for your kids. Here's another one that's going to hurt real people. You know how if you lose your job or get divorced or have a baby, you can sign up for health insurance right away? Those are called special enrollment periods. Well, they just eliminated most of them. And for the few that remain, you don't get any help paying for it. No premium tax credits. Nothing. So let's say you're working at a restaurant, you lose your job in March, and you need health insurance. Under the old rules, you could sign up right away and get help paying for it. Under the new rules, you either pay full price, which could be $800 a month for a decent plan, or you wait until November to sign up for January coverage. What are you supposed to do for 9 months? Just hope you don't get sick? Just pray your kids don't break a bone? And here's the cruelest part. They eliminated the protection against what we call premium tax credit clawbacks. Here's how this works. When you sign up for marketplace insurance, you estimate your income for the year. If you estimate wrong and make more money than you thought, you have to pay back some of those premium tax credits at tax time. Under the old rules, there was a limit to how much you had to pay back. If you were a family making $40,000 and you accidentally underestimated your income, you might owe $300, $600 at tax time. Manageable, right? Under the new rules, there's no limit. You could owe $3,000, $5,000, even $10,000 in surprise tax bills. And this isn't theoretical. This is going to happen to hundreds of thousands of families. Now, let's talk about Medicaid. Because this is where things get really ugly. They're implementing mandatory work requirements for anyone on Medicaid expansion. Here's what this means. If you're an adult between 18 and 65, not disabled, and not caring for a child under 13, you have to work at least 20 hours a week or you lose your Medicaid coverage. Now, some of you might be thinking, well, that sounds reasonable. People should work. But here's what they're not telling you. These aren't just unemployed people sitting around. Many Medicaid recipients work multiple part-time jobs that don't offer health insurance. They work in restaurants, retail, gig economy jobs. They're already working, they're just not working the right kind of jobs according to Congress. And here's the really messed up part. If you're a seasonal worker, like someone who works at a ski resort or a beach town, you still have to meet these requirements year-round. So if you work 60 hours a week during tourist season but are unemployed in the off-season, you lose your coverage. The bureaucracy around this is going to be insane. States have to track work hours, verify employment, process exemptions, and if you miss reporting 1 month, coverage terminated. But the real money in this bill comes from something called provider taxes. This is wonky, but stay with me because it affects everyone. States levy taxes on hospitals, nursing homes, and other healthcare providers, and then use that money to help fund their Medicaid programs. It's been working for decades. Well, Congress just slashed the amount states can collect from these taxes. For states that expanded Medicaid, they're cutting the limit from 6% down to 3.5% over the next few years. What does this mean in real terms? States are going to lose billions of dollars in Medicaid funding. And when states lose Medicaid funding, they cut services, reduce provider payments, or kick people off the program. We're talking about $344 billion in lost funding over 10 years. That's not pocket change. That's enough to fund the entire Medicaid program in Texas for 3 years. They're also making it harder to stay on Medicaid. They're requiring more frequent eligibility checks, more documentation, more verification. You know what this means? More people are going to lose coverage due to paperwork errors, not because they're no longer eligible. Studies show that when states implement these kinds of administrative burdens, 30–40% of people who lose coverage are still eligible. They just got caught up in the bureaucracy. Imagine losing health insurance for your kids because you moved and forgot to update your address with 3 different government agencies. Now, let's talk Medicare, because seniors are getting hit too, just in a different way. You know how Medicare finally started negotiating prescription drug prices to make them more affordable? Well, they just poked a giant hole in that program. They expanded the exemption for orphan drugs, medications for rare diseases. Under the old rules, if a drug only treated one rare disease, it was exempt from price negotiation. Under the new rules, if a drug treats multiple rare diseases, it's also exempt. This sounds technical, but here's what it means in dollars and cents. The Congressional Budget Office says this change will cost Medicare, and by extension, seniors, an extra $4.9 billion over 10 years. That's $4.9 billion that could have been used to make medications more affordable, instead going to protect pharmaceutical company profits. And here's the really cynical part. Drug companies can now just find additional rare disease uses for their expensive medications to get them exempted from price negotiation. It's a loophole you could drive a truck through. There is some good news for Medicare. Doctors who treat Medicare patients are getting a 2.5% payment increase in 2026. This is actually important because Medicare typically pays doctors less than private insurance, and many doctors have been limiting the number of Medicare patients they see. So this could help seniors find doctors more easily. But, and there's always a but, this is just a one-year fix. The House wanted to make permanent inflation adjustments to doctor payments. The Senate said no. So we're back to the same problem in 2027. And here's something that's flying under the radar. They're barring certain legal immigrants from Medicare. We're talking about refugees, asylum seekers, people who came here legally but don't have full citizenship yet. These are people who fled war zones, domestic violence, human trafficking. Many of these people have been working and paying into Medicare for years, but now they can't benefit from it when they get older. This affects the same populations losing ACA coverage. It's like Congress decided to systematically remove healthcare access from entire groups of legal immigrants. Now, Congress knows these cuts are going to hurt, especially in rural areas. So they created what they're calling a Rural Health Transformation Program with $25 billion in funding. Sounds great, right? $25 billion are to help rural healthcare. But here's the catch, and this is straight out of a political playbook. The money isn't automatic. States have to apply for it, and one person gets to decide who gets funding and who doesn't. The administrator of CMS, Dr. Oz. That's right. The TV doctor who sold miracle weight loss pills gets sole discretion over $25 billion in rural health funding. And the law specifically says there's no appeals process, no judicial review. His decision is final. So if you're a state that didn't vote the right way, or if your application doesn't align with whatever Dr. Oz thinks is important that week, you could get nothing. This isn't a healthcare program. It's a political slush fund. Here's what makes this whole situation terrifying: the timeline. Most of these changes take effect January 1st, 2026. That's 5.5 months away. Enhanced premium tax credits? Gone January 1st. Automatic enrollment? Gone January 1st. Special enrollment periods? Mostly gone January 1st. Medicaid work requirements? States have to implement them within 12 months. And we're getting this information in July, when most people are thinking about summer vacation, not health insurance. The normal open enrollment period for 2026 coverage starts November 1st. That means people have less than 4 months to figure out how these changes affect them and make new plans. Insurance companies are scrambling to reprice their plans. States are trying to figure out how to implement work requirements. And consumers? Most consumers have no idea any of this is happening. If you currently get insurance through healthcare.gov or your state marketplace, here's what you need to do. First, assume your 2026 premium is going to be significantly higher. Start budgeting for it now. If you're currently paying $200 a month, plan for $600, $800. If you're paying $400, plan for $1,200. Second, make sure all your documentation is perfect. Income verification, address, citizenship status. Everything needs to be exactly right because they're going to be checking everything. Third, don't count on special enrollment periods. If you have a life change, job loss, divorce, moving, you need to plan for potentially paying full premium or waiting until the next open enrollment. Fourth, if you're anywhere close to the income limits, be very careful about income fluctuations. One good month could trigger a massive tax bill. If you're on Medicare, the changes are less dramatic but still important. Your prescription drug costs might go up, especially if you take medications for rare conditions. Start looking into Medicare Part D plans now for 2026. You might need to switch to a plan with better coverage for your specific medications. The good news is doctor payments are going up, so you might have an easier time finding doctors who accept Medicare. But if you're a legal immigrant who isn't a full citizen yet, you need to understand exactly how these new restrictions might affect you. If you're on Medicaid, especially Medicaid expansion, you need to start documenting everything. If you work, keep meticulous records of your work hours. If you can't work due to disability, make sure you have current medical documentation. If you're caring for children, keep records of that too. States are going to be required to implement these work requirements, and the bureaucracy is going to be a nightmare. The more documentation you have, the better protected you'll be. Look, I know this is overwhelming. I know it's scary. And I know it feels like the system is designed to work against you, because frankly, it is. But here's the thing. This is exactly why Xactinsure exists. We've been fighting these battles for years, and we're not going anywhere. Starting right now, we're launching what we're calling our Healthcare Defense Initiative. Here's what that means. We're going to help you navigate every single one of these changes. Premium increases. We'll help you find the most affordable options. New verification requirements? We'll make sure your paperwork is bulletproof. Lost your special enrollment period? We'll help you find alternative solutions. We're also going to be monitoring the implementation of these changes state by state, because I guarantee you there's going to be confusion, delays, and probably lawsuits. If you're watching this video, you're already ahead of 95% of Americans who have no idea what's coming. But knowing about the problem is only half the battle. You need a team in your corner who understands the system and can help you fight it. That's what we do. That's what we've always done. And that's what we're going to keep doing no matter what Congress throws at us. Here's what I need you to do right now. First, subscribe to this channel and hit the notification bell. We're going to be putting out weekly updates as these changes get implemented, and you need to stay informed. Second, share this video. I'm serious. Share it with your family, your friends, your coworkers. Most people have no idea this is coming, and they need to know. Third, if you need help navigating any of this, contact us at Xactinsure. We're offering free consultations through the end of the year for anyone affected by these changes. Our contact information is in the description below. And finally, Start preparing now. Don't wait until November. Don't wait until January. The changes are coming whether we like it or not, and the people who prepare are the ones who are going to come out okay. This is the biggest change to American healthcare since the ACA was passed in 2010. But unlike when the ACA was passed, these changes are designed to reduce coverage, not expand it. We're going to get through this together, but we have to start now. I know this wasn't the most uplifting video we've ever made, but sometimes the truth isn't uplifting. Sometimes the truth is that powerful people make decisions that hurt regular families, and those families need to know what's coming so they can protect themselves. That's what we're here for. That's what we'll always be here for. This is Xactinsure. Thanks for watching, and we'll see you next week with more updates on how to protect your family's healthcare.